Hello and namaste everyone. As a continuation of the talk on osteology of skull, today we are going to deal with the Norma lateralis or the lateral view of the skull. It includes the features of skull observed from its lateral side. Many bones can be seen in this view, such as the frontal, a quadrilateral bone known as parietal, occipital, greater wing of sphenoid, temporal bone, nasal, maxilla, lacrimal bone which is broken in this specimen, zygomatic or the cheek bone, and the mandible. The prominent features are temporal line, the temporal fossa, zygomatic arch, external acoustic meatus, the suprameatal triangle, the mastoid process of the temporal bone, and styloid process of the temporal bone. If the mandible and the zygomatic arch is to be removed from this view, the infratemporal fossa present inferior to the zygomatic arch and the pterygopalatine fossa formed by the pterygoid plate of the sphenoid bone and palatine bone can also be visualized. Temporal lines seen in the superior view can be appreciated in this view too. The term temporal is supposedly derived from the fact that with age or time, graying of hair occurred first in this area. The term tempus basically means time. A single temporal line arches superiorly and posteriorly from zygomatic process of the frontal bone. This line passes over the parietal bone where it splits into the superior and the inferior temporal lines. If we trace the lines posteriorly, superior temporal line tends to fade away, whereas the inferior temporal line reaches the supramastoid crest. These temporal lines form the superior boundary of the temporal fossa, a shallow area on the lateral aspect of the skull. The temporal fascia, which is the thickest fascia in our body, is attached to the superior temporal line, while inferior temporal line indicates the superior limit of the origin of temporalis, one of the muscle of mastication. Temporal fossa is one of the largest landmark on skull present on the lateral aspect. It is bounded superiorly and posteriorly by superior temporal line, whereas it is bounded anteriorly by the frontal process of the zygomatic bone and zygomatic process of the frontal bone. Inferior boundary of the temporal fossa is formed by the zygomatic arch. The temporal fascia forms the roof of the fossa. The floor of the temporal fossa is formed by parts of frontal, parietal, squamous part of temporal bone and the greater wing of sphenoid. The temporal fossa gives origin to temporalis. Inferior to the zygomatic arch, temporal fossa is in communication with the infratemporal fossa. On the floor of the temporal fossa, an important landmark called terion is present, which is often considered as the weakest part of the skull. The Greek term pteron means wing, as in Greek mythology, a messenger of God was able to fly by wings on his head, which were attached at the terion. Terion is roughly H-shaped sutural junction where four bones, frontal, antero-inferior angle of the parietal, squamous part of temporal, and greater wing of sphenoid meet each other. The sutures involved are the squamous suture, the coronal suture, spheno-parietal suture, spheno-frontal suture, and spheno-squamosal suture. The central point of terion known as Sylvian point, is situated 4 cm above the midpoint of zygomatic arch. Terion corresponds to the site of anterolateral or sphenoidal fontanelle of the neonatal skull, which tends to close by 3rd month after birth. As stated previously, Terion is an important anthropometric landmark because it overlies the anterior or frontal branch of middle meningeal artery, its accompanying vein, and in more deeper plane, stem of lateral sulcus or Sylvian sulcus of cerebrum. Fracture or even a blow at this point may injure middle meningeal vessels and give rise to extradural, also known as epidural hematoma. Knowledge of middle meningeal artery surface anatomy is therefore important for accurate positioning of burr holes to evacuate extradural hematomas. Terion also acts as a landmark for surgeons trying to approach the anterior and middle cranial fossae. If we observe carefully, the inner aspect of 4 angles of quadrilateral bone known as parietal bone is vascular. Terion, as just mentioned, is related to middle meningeal vessels. The asterion is related to sigmoid sinus, and bregma and lambda are related to superior sagittal sinus. The palpable and prominent zygomatic arch, sometimes referred to as zygoma, is formed by the articulation between the zygomatic process of the temporal bone posteriorly and the temporal process of zygomatic bone anteriorly. Though some people use the terms zygomatic arch and cheekbone interchangeably, we need to be aware that the arch is part of cheekbone or zygomatic bone. The superficial temporal vessels and auriculotemporal nerve cross the root of the zygomatic arch in front of the auricle. The superficial temporal artery can be felt at this site, especially by the anesthetist who sits at the head end of the patient during surgery. The upper border of zygomatic arch is the site of attachment of temporal fascia and gallia aponeurotica. Similarly, the lower border of zygomatic arch gives origin to masseter, one of the muscles of mastication. The external acoustic meatus, which marks the initiation of external acoustic canal, is situated below posterior aspect of the zygomatic arch. The roof and upper part of the posterior wall is formed by squamous part of temporal bone, while the posterior part, the anterior wall, and the floor of the external acoustic meatus is formed by tympanic part of temporal bone. A triangular fossa known as suprameatal triangle or McEwan's triangle, related to the posterior-superior aspect of the external acoustic meatus, is present on the mastoid part of the temporal bone. The boundaries of this triangle include supramastoid crest present superiorly, posterior-superior margin of external acoustic meatus, which forms the anterior boundary, and an imaginary line passing through the posterior border of external acoustic meatus, which forms the posterior boundary. This anatomical site has important clinical relevance in regards to minimizing injury to facial nerve and the sigmoid sinus while accessing mastoid antrum and performing mastoidectomy. A conical projection from mastoid part of temporal bone known as mastoid process is present on the posterior-inferior aspect of the external acoustic meatus. The term mastoid is derived from Greek term mastos, which means breast. It may be named so because of the shape of this process. The mastoid process is closely related to the occipital artery on its medial aspect. Muscles such as sternocleidomastoid, posterior belly of digastric, splenius capitis, and longissimus capitis are attached to this bony process. This process gradually enlarges in the skull during postnatal life due to the pull of sternocleidomastoid and becomes palpable just behind the ear by second year of life. Air spaces which are in communication with middle ear cavity are contained within mastoid process, which are known as mastoid air cells of Lenoir. The term cell used here refers to closed spaces and not the structural and functional unit of life cell. The infection of these cells is known as mastoiditis. The styloid process, which is a slender downward projection from the petrous part of the temporal bone, can be seen if we remove the mandible. It is a site of attachment of the three muscles, which are the stylopharyngeus, the styloglossus, and stylohyoid. It also gives attachment to the two ligaments, which are the stylomandibular and stylohyoid. In some rare instances, a long styloid process comes in contact with the tissues in the throat during acts of swallowing or turning the head. This is known as eagle syndrome or stylalgia. So, this was a brief description of the lateral view of skull. Thank you for watching.